Good afternoon, Camden and Duty, can I help?
Okay, what's his name? And date of birth? Okay, and where was he picked up? In the street, okay. So he's at accident and emergency? Okay, let me just see if he's known to us, and I'll give you a call back to let you know what time we should be down.
Teresa Rennick works for Camden and Islington NHS Foundation Trust, known as C&I. She is one of a team of 60 staff who work across both London boroughs and make assessments on people's mental health. Teresa is an approved mental health professional, often known as an AMHP or AMP. All of our AMPs are approved either by Camden or Islington councils.
Approved mental health professionals primarily work with people who are experiencing a mental health crisis. They might have been brought to hospital by family members, by friends, by members of the public, by the police, or themselves they may have gone to hospital because they're not feeling very well and they want to find out what's happened to them. We will undertake assessments under the Mental Health Act to see if somebody needs to be in hospital to receive treatment for their mental illness.
The vast majority of people are never seen by an AMP, but if the AMP team are called, they make a decision about whether an assessment needs to be done.
Whenever we take assessments under the Mental Health Act, there's always an AMP, such as myself, and 2 doctors as part of that assessment. The majority of people don't come into hospital. They're actually able to go back home with additional support from something such as the crisis resolution team. Throughout the assessment, it's really important that we are showing kindness, respect, and that we're quite supportive, we're very supportive of the service user during the assessment. We try to ensure that patients are able to bring in home comforts, such as any hobbies that they may have, like reading or artwork, so that they can have some familiarity when they're in hospital. And of course, we're always trying to ensure that we're doing this in the most gentle, humane way possible, absolutely upholding human rights at all times.
The Camden and Islington AMP team make around 850 assessments a year. Natasha Sloman has been an AMP for 12 years.
The main aim of undertaking an assessment under the Mental Health Act is really to ensure that people are safe and that when they are going through a period of significant crisis, services intervene to ensure that we can give them the right care and support that they need.
And that can happen in the community, but sometimes you might need to take them into hospital. But people get scared of that, don't they?
I think there's a lot of stigma around the use of the Mental Health Act and people don't understand it. So it's often portrayed in a way which is dramatised and made quite scary for individuals. But actually, the assessment process itself always looks to try and ensure that people get the right services at the right time. And that can sometimes mean that people will get intensive care at home, or it may well be that they need to come into hospital.
The AMPs work closely with the police, the ambulance service, local A&D, and a host of other services. If an incident happens in the community, the police are often the first on the scene.
We arrived at the scene to find the subject with his shirt open and standing in the road shouting. He was not wearing any shoes. He looked confused and as if he could have been intoxicated on alcohol or drugs. So we approached him cautiously, as he might be dangerous, but with the belief he was a vulnerable person. We tried to use gentle tones to bring his awareness to us and tried to talk him round and pacify his anxieties. This worked, and we then led him to the car, explaining that we wanted to help him and we were going to take him to a place of safety. So he was being arrested under Section 136 of the Mental Health Act for his own protection.
I don't remember everything totally clearly, but I do remember seeing the police, and I was kind of like freaked out. They caught me and talked to me, telling me everything was okay, and they just wanted to help.
Assessments take place at a local A&E department, at a police station, or even at home.
So you've been brought to hospital under something called Section 136 by the police, and we're going to assess you today to see if you need to be in hospital under Section 2 of the Mental Health Act. So that's for a maximum of 28 days. I'm going to let the doctors introduce themselves.
Dr. Farah Anwar is a Section 12 approved consultant at C&I. This means he, along with the AMPs, can assess people's mental state.
Well, essentially, once we've identified a client who needs to have a mental health assessment, The AMP will call out a Section 12 doctor. We will meet at the place where the client is. It could be A&E, it could be a police station, sometimes it's at home. And we try and establish a conversation with the client. We try and reassure them as much as possible that essentially we're there to help them in a crisis situation, whatever time of day it might be. And the best fit for their needs is what we're trying to establish. Now that best fit may be the fact that actually the crisis is fairly minor, it's not an emergency, it doesn't require an immediate intervention, it requires communication links the next day between a GP or community mental health team or whatever it might be. It could be that the client actually isn't suffering from a mental disorder as defined by the Mental Health Act. It's someone who's intoxicated, possibly just very anxious, although anxiety can be a mental disorder. But we've got to establish what intervention is required at that time. And as I said, we're trying to avoid detaining under the Mental Health Act. That's absolutely the last resort.
Wherever the assessments take place, all of our AMHPs and doctors comply with the Mental Health Act and its accompanying code of practice and ensure the least restrictive option. And also, importantly, our teams demonstrate CNI values, behaving in a respectful, kind, professional and positive way. Of course, having to detain people is never easy. And as you might expect, some people react angrily to being detained.
It's not nice. You can't do the things you want to do when you want to do them. You have to depend on other people all the time, them saying you can do it.
It's humiliated. You feel absolutely humiliated. You feel powerless. You feel deprived of your liberty, and it's very difficult for you.
It feels really sort of stuck, like somebody's taken away something from me, like my rights, just my freedom, my liberty, just everything, taken away my whole life and just sort of locked me away. Like if I've done something wrong, sort of to be put in a hospital against my will actually feels as though I've committed some kind of crime and been locked away, because that's what it feels like being in hospital when you can't leave.
Part of the aim of this film is to try and educate people about what it really means to come into hospital and why it can actually be a very positive event to happen to somebody. It can be positive because it can help people recover much more quickly, and the more intensive the support that they get and the care and treatment that's provided, more quickly they can get to regain their independence and return home.
If someone needs to be detained, they'll be taken to hospital at C&I's Highgate Mental Health Centre or the Huntley Centre for further assessment. Highgate is a purpose-built, modern centre and has some of the best treatment from some of the most highly trained staff in the country. Out of the 800 plus people we see each year, the majority end up returning home after having had a course of treatment.
The aim of the team is essentially to keep people safe and to help them recover in the least time possible. And that's what I and the rest of the team set out to do every day.